Equine psychotherapy is an extremely familiar process of going through psychotherapy. The use of animals in different types of psychotherapy has been around from as early as 1792. Therefore, using animals in therapies is not a new concept. In equine-assisted therapy, EAP, horses are used to help people with psychological problems. In EAET, equine-assisted experiential therapy is used with specific equine activities to give clients the opportunity to work through unfinished business, relieve psychological distress, live more fully in the present, and change destructive patterns of behavior. Many people have been pondering on the fact that equine-assisted psychotherapy is not effective, but studies have shown a more positive result when using animals in therapy. Not just any trainer or any horse can be involved in this process. 2 male and 3 female psychotherapists lead the groups. All psychotherapists are master's levels, are licensed, and have achieved a level 2 certification in experiential therapy from the American Society of Experiential Therapists, ASET. These trainers average 15 years experience in the area of experiential therapy and 3 years experience in EAET. Horses chosen to work in the program are calm, easy to approach, able to accept people walking around all sides and touching all areas, aged, halter and saddle trained, geldings or mares, and were all from the same herd. These horses are chosen like this so no one feels intimidated while around them. The human-animal bond is a well-documented phenomenon that has been around since humans began domesticating animals. The science of understanding the human-animal connection appears to have made some healthy forward steps since the National Institutes of Health convened a workshop on the health benefits for pets in 1987. Encouraging touch and giving humans a loving creature to care for stimulates physical reactions that are very necessary and important in humans. Equine psychotherapy is such a moving process that it does not only play a role in the child or adult's life, it plays a role in the family's life. A parent with a son who uses equine psychotherapy is quoted in an interview conducted on January 31, 2012. As a loving mom, it has been incredibly challenging to see the initial extent of Scott's injuries. It has also been amazing to see his progress. Initially, his accident was marked on police reports as a fatality, and the hospital personnel did not expect him to live. Also said in the same interview, I am so grateful for the strength, patience, and gratitude he has put forth in his recovery. I am so thankful for the strength that our family has received from God, from loving family and friends, and for the dedicated and patient professionals who have worked with Scott, including the equine and canine ones. As said in the same interview held on January 31, 2012, he is more confident, more relaxed, and enjoys life more. Near the beginning of Scott's recovery, when he was first visited by the dogs at Shepherd Hospital, he was not responding to much of anything, sitting almost lifeless in a wheelchair. 3 years later, he is very involved in life, but with his type of brain injury, short-term memory is a big problem. The repetition of grooming the horse at Roosevelt Institute from week to week was a valuable but enjoyable skill for him to expand his memory.
Every time we go down there, she's just really ready and willing to just jump on the horse. She's not afraid of it. Whereas, when we bring her to physical therapy or when someone comes here to work with her, it's not that easy because she's in her, own environment. She's comfortable, so she might not, want to do some things or get away with something more than she would if she was outside of the house. And she loves animals. I mean, she just blossoms when she goes down there, and it just seems like she never wants to leave.
Sessions can differ from the different adolescents. As said in an interview held on February 6, 2012 with Gloria Griffin, a counselor at Forward Strides Counseling, we do so many different activities depending on individual or group therapy. With groups, we can do some fun competitions, relays, etc. We can play games using the horses as tools for getting to goals. Individual activities can range from simply observing horses, being near them, grooming, to making the horses go over jumps or work in patterns. We try to plan our sessions based on the client needs. Many people think that more traditional therapies are better than equine psychotherapy because of the responses from the adults and children that go through the equine psychotherapy. Some scientists argue that equine psychotherapy is not 100% accurate and effective. EAP does not appear to be harmful, but there is no evidence that it is efficacious in the treatment of mental illness. These statistics may be true, but scientists have also found a more positive result in children using equine psychotherapy compared to using other psychotherapies like group therapy or behavioral therapy. Some facts that help conclude the fact that equine psychotherapy is more effective is that the child is more engaged in the activities and is willing to be out and around the animals. Equine psychotherapy is not harmful, but with more responses from families going through equine psychotherapy, these statistics will change. Equine psychotherapy is just one of the many types of psychotherapies somebody could put their child through. This psychotherapy has many more upsides than a vast amount of other therapies. The way that this psychotherapy keeps the child or adults focused on what is happening, makes them build not only mental but physical strength, and helps them become more comfortable with the animal is astonishing.